Hey massage therapist, have you ever wondered why a client's muscles are tight? Have you ever worked on somebody and they felt great and then they came back and then it came all right back? Maybe you're working on the upper traps, the QL, the piriformis just constantly, and it's just not releasing, not letting go, or it's coming right back, all that tension and pain. The problem lies when the massage therapist tends to focus on the pain rather than the pattern, and why is it getting tight in the first place? Let's talk about compensation patterns, spinal injuries, disc injuries, and nerve irritation. I'm telling you, once you understand this, you're going to start looking at every client a little bit differently. One of the biggest problems is when we assume that a pain equals there's damage. But that's not how the nervous system actually works. The nervous system has one primary job: keep the body safe. Keep the body safe. When the body senses a threat, disc injury, joint irritation, inflamed nerves, or just simply movement starts to feel unsafe, the nervous system sends messages to tell the body to move differently. Because the nervous system is trying to protect your body, so sometimes, for example, it'll send a pain signal to tell the body not to move even when your body's not even in pain. The body is going to start reducing movement and muscle guarding begins. That could be shifting weight, changing posture, or even alter the way somebody walks. Now, these protection patterns, they help in the beginning, but in the short term. But in the long term, after the injury has already improved, the compensation has already done its damage. As a therapist, you got to treat the compensation and not just the problem. Clients are going to constantly say, oh, my muscles are tight, my muscles are tight. But many times, it's not tight because it's shortened. It's tight because the nervous system itself is telling it to stay tight. Think about it like this. If you're leaving your car engine idling all day long, eventually that car is going to get tired. So common examples with the body might be tight lumbar, QL, hip flexors, glutes, thoracic muscles. Muscles are acting like a brace around that area. And that would be why aggressive stretching, painful deep tissue massage, forcing things to let go, will not work. If the nervous system, even after the massage, feels like it's still dangerous to move, it's going to still attack that and keep you from movement. So even after you loosened everything up, it's going to go, you know what, fine, I'll just tighten it all back up again. Contrary to what it may think I'm saying, I'm not saying our goal is to fight the nervous system. You won't win that, and it's not our job. Our job is simply, as massage therapists, to teach the body, teach the nervous system that movement is safe. Now here's something that surprises a lot of massage therapists, and I really like to dive into, is why do muscles in themselves turn off? Sometimes a muscle is going to look weak, but it's not weak. The nervous system just isn't allowing the activation of that muscle, or at least not allowing it to fully activate. This is called protective inhibition. You're going to commonly see this with maybe your glutes. Maybe the glutes aren't firing, your deep core muscles, parts of your rotator cuff muscles. Remember, your rotator cuff muscles can be your stabilizers for your shoulders, so if they're not turning on, it can influence other things to happen. The muscles have capacity to work, we just have to teach them and train them. That's why exercise is so important. And even in a massage, as a massage therapist, you can activate muscles. That's why in my massages, I actually have resistance bands that I'll have them activate that muscle during the massage to see if they can activate it. Remember, your nervous system controls everything. So if it doesn't feel like, hey, that muscle needs to contribute, it's not going to have it contribute. We're trying to help with the nervous system's protective response. Another example I try to teach therapists, or even teach my clients, is if I'm doing a stretch or opening their mobility in their shoulders, I don't have them just raise their arm. I try to have them look at their hand and move back. Because when they do that, it signals, the eyes see the movement, so it sees that the movement is safe. If it doesn't, it might lock it up. Another example, if a client has left leg sciatica, what usually happens? Usually they don't want to stand on that painful leg. They start loading the other leg. Over time, that can create more and more issues. An example would be, now my right hip hurts. Now my right knee hurts. My right foot hurts. My ankle hurts. But the problem originally was in the left leg. But their compensation is causing a lot of problems. Eventually they may tell you their whole body hurts, all because of the protective strategy of the body. Another common example would be hip hikes. One side of the pelvis will elevate. QL muscle gets overactive. The ribs compress. One shoulder becomes higher. Walking then begins changing. Again, the elevated hip may not be the original problem. It's a problem, but it's not what's causing everything. It's a symptom. That was just your body's reaction and trying to protect the area at the time. The body doesn't work in isolated pieces. It works as an integrated system. A stiff ankle may eventually lead to hip pain. A weak hip may lead to a lumbar issue or can overload the lumbar spine. Poor thoracic mobility will influence the neck. Reduced arm swing changes rotation, changes thoracic rotation. Everything affects everything else. That's why treating the painful muscle, which you should still do, is going to be limited results. It's going to solve the problem for that day, maybe. Instead, we need to ask, what's causing the big picture? Why is this muscle stiff and working so hard? Breathing changes everything. Pain changes breathing. An example would be clients will stop expanding the lower rib muscles. Then they breathe more in their upper chest. The diaphragm becomes less active. Then the accessory breathing muscles start doing all the work. Scalenes, upper trap, sternocleidomastoid. It's kind of like, employees. You have some employees having to do all the work because these employees aren't doing the work. Well, these employees that are doing all the work, they're going to come to the office and start complaining. Sometimes the neck pain that's caused by that is just the beginning of the story. It's simply helping them breathe. One final point I'm going to make, and you can check out my other videos on the spinal mechanics. And if you're interested in a CEU course, check out that in the description as well. It's online. I think you're going to get a lot out of it. Don't just treat the MRI if they give you the MRI results. Disc bulges, degeneration, facet arthritis, even herniations. They may or may not explain the symptoms. Instead, observe the client's pattern that's in front of you. Look at their posture. Watch them walk. Assess their breathing. Notice weight shifting. See which muscles appear to be overly tight, overactive. Which ones are having trouble activating. Clinical reasoning like this is going to take your career to the next level. So the big takeaways, the nervous system is going to protect first. It wants safety. Most or many tight muscles that we work on are not the original problem. They're responding to the body's protective strategy. The more you understand compensation pattern, the better you're going to be at having lasting results and helping the client understand their pain. That way it makes sense to them even after the injury itself has improved. Why do they have other issues? If this is helpful, make sure you hit subscribe, like, share, and if you have any questions, comment below.